structured, rigid, and practical. In life, we often find ourselves operating within similar boxes, rules, traditions, and systems that guide our choices. You're taught to put apples in the apple box, not oranges, not bananas. While these systems of thinking may be great, they can often confine us, limiting the way we think. The magic of the apple box lies in how it's used beyond its intended purpose. In the world of filmmaking, apple boxes are far more than mere fruit crates. Sometimes they're stepping stools, sometimes they're makeshift seats, and other times they might be supports for a tricky camera. On a film set, creativity flows freely, and the apple box becomes a tool for thinking outside the box, both literally and figuratively. It is anything but a box. Much like how a filmmaker reimagines the apple box, we have got to reimagine the way we see healthcare. Medicine, for all its advances, often stays within its box, confined by traditions and outdated practices. This can lead us to some complications, and we need to learn how to think outside the box. Now it's time for a quick little personal backstory. My father, who was a doctor, he commits himself to the care of his patients. He often took me to see the inner workings of his practice. He would show me around his patients sometimes, and some of whom were suffering from antibiotic resistance. Other times, he would take me to see tech innovations that were happening in the medical industry at that time, like robotic-assisted surgeries. This has shown me the enormous extent of what is there to be discovered beyond the textbook, and it's shaped me profoundly. Today, I invite you, yes, all of you, to abandon your apple boxes as you know them. Let's start off with my first topic, proactive care. Now, what is proactive care? It's the complete opposite to reactive care, which is the traditional way of treating patients. Reactive care means we only treat the disease after symptoms start to show. This can often create higher medical costs and a medical system that is struggling to keep up with new diseases and new patients. By the time people seek help, it often might be too late, and it creates worse patient outcomes. It's like fixing a leaky roof after the rain's already pouring. Proactive care says, why wait for the rain? Why not build a stronger roof now? Take heart disease, for example, the #1 cause of death worldwide. Proactive care encourages the patient to track their cholesterol, improve their diet, and even exercise based on their own needs. Same applies to type 2 diabetes. Proactive care can delay or even eliminate entirely the need for insulin. Companies like Crossover Health have proven that proactive care can reduce ER visits as well as costs, which creates healthier patients. If we truly want to revolutionize healthcare, we have got to focus on prevention to start, right? Now, proactive care is like preventing a storm. What about times when the storm has already hit? Medicine is becoming more personalized, and that's a good thing. In the past, doctors often adopted a one-size-fits-all approach. Have you ever been to a hospital and the doctor just asks for your symptoms and he just gives you some medicine? This can often lead to side effects, trial and error medication, as well as a system that is struggling to understand what is truly happening beneath the surface. Now, newer medications are focusing more on individuality, focusing more on your own person. That's why we say your genetics, your needs. Take benralizumab, for example, a new type of medication specifically designed to treat severe asthma. It works differently from traditional steroids because traditional steroids affect every part of the body, which is bad. Benralizumab only targets those that cause inflammation, which helps treat the patients. Cancer treatment is also becoming more personalized. In the past, we used chemotherapy, which kills both the healthy and cancerous cells, and we don't want that. We want to leave the healthy cells alone. Newer treatment options, like immunotherapy, trains your body's immune system to fight off cancer on its own. While these sound advanced, there's a more powerful force behind the scenes. By analyzing thousands, if not hundreds of thousands of medical cases, AI helps doctors choose what's best for their patients by giving them the correct treatment and probabilities of what kind of disease that actually is. What excites me the most is that we're moving past an age where medicine is all about guessing based on symptoms that they show. It's about precision and efficiency. Now, while all of these might sound very science fiction, nothing quite compares to what I'm about to show you next. Something so powerful, you don't even realize that it's already here, because it sounds like something straight out of a science fiction movie. CRISPR, one of the most, if not the most important breakthroughs in modern-day science. It's a tool that allows us to cut up and edit DNA based on our needs. This gives us the ability to correct and fix genetic defects with editing our DNA. Stanford research already shows that CRISPR is being used to correct genetic defects such as sickle cell anemia and hereditary blindness. This can change medicine forever. Diseases like cystic fibrosis, Huntington's disease, and even some cancers might soon be able to be treated with a one-time genetic code correction. Scientists are also finding ways that CRISPR could help us slow aging or even provide immunity against diseases like HIV. But there are concerns. CRISPR isn't perfect. Being a new technology, it sometimes makes mistakes, but those mistakes are really, really dangerous. There are also concerns that only the wealthy may be able to access this kind of technology, creating a healthcare divide. And on the ethical side of things like genetically modified babies also bring into question why CRISPR is still a developing technology. But that's all great, and CRISPR is still a huge leap forward. And sometimes our newest innovations don't have to come from always moving forward. It can sometimes come from taking a few steps back. One of the greatest threats to modern-day medicine isn't a disease we've never heard before. It's one we thought we had under control. Antibiotic resistance bacteria. Think of the last time you took penicillin. You're helping to create immunity for bacteria because they evolve and learn how to make these antibiotics useless. I saw it up close in one of my dad's patients. Simple infections that just won't go away, no matter how hard he's trying. It's not because the care wasn't good. It's because the medicine we've been relying on for ages has suddenly turned obsolete. Now, the WHO is sounding an alarm. If we don't act, antibiotic resistance could take up to 10 million lives a year by 2050. That's not science fiction. That is hard facts and the brutal reality that we have got to learn to face. One promising treatment, though, is phage therapy. Researchers have found phages, which are naturally occurring viruses that target the harmful bacteria, killing them. What's good about phage therapy is that it leaves our body cells alone. Phage therapy is already saving lives. Patients with infections resistant to every antibiotic available to us on the market have fully recovered after receiving phage therapy. Researchers are also developing ways that we can develop a sort of phage library, just like how a blood bank matches blood to its recipient. We can match virus to infections, creating a more streamlined process. What is fascinating to me is that phages were discovered in the early 1900s, but were largely ignored due to how cheap and easy antibiotic treatment was. Now, with resistance on the rise, we're moving back to an old idea with a new approach. This is proof that innovation doesn't always have to come from the newest of ideas. It can sometimes come from the old ones. And innovative thinking and medical fields is all about that. It's not always about coming up with new things and focusing on them, like CRISPR. It's also about revisiting old technologies and reinforcing that idea with our present knowledge. And to me, that's what innovation is all about. Not always coming up with new things, but seeing old things in brand new things. Now, remember the apple box? It may contain apples, but it also contains concepts of reinvention, creativity, and innovation. That might sound amazing, but sometimes the apple box constrains us with traditions and systems. And with complex challenges like these, we've got to learn to think outside the box. Sometimes it's about reshaping the box, and other times it's about breaking the box entirely. As we expand the horizons of knowledge, we've got to learn that new ideas don't always have to come up. We have good ones already, and we need to learn to reinforce them. And that's why I urge each and every one of you to rethink the unspoken rules that you pose on yourselves every day. And look past that and have the audacity to ask, why not? And what if? As frequently as we can. Because in a world filled with complex challenges, the most efficient ones may be those we have yet to conceive. Thank you for exploring the unknown with me today.